Hello everyone, I am Saikolappan Sankaralingam and I am a PhD in microbiology. Your news source, social media, and discussion groups may be filled with information on COVID 19. So, what's different about this? Not a great deal, but I'm going to try to analyze the worldwide impact of the pandemic to understand what is helping the spread and what is hurting it. We keep hearing a lot about these phrases: keep social distance, break the chain, and keeping the curve flat. Why is there so much insistence on these phrases? And what do they have in relation to the current scenario of the pandemic? To understand these phrases, you must keep in mind your virus needs a living cell of another organism, like human beings, for it to replicate. That is, to make more copies of itself and keep its chain of infection going. An infected individual can be symptomatic or asymptomatic. Any individual, by limiting his contact to a known or unknown infected individual by means of maintaining a safe, necessary distance, can break this chain of infection. As you look at the worldwide impact of this disease, you will understand social distancing is the key to break the chain of virus spread. To begin with, let's look at the current scenario by comparing the impact of the disease between a select few countries. Before that, I would like to acknowledge the COVID-19 website of worldometer.info for the information based on which I present my discussion. So, let's start with China, where the pandemic started. You can see here 0.0057% of the total population of China were infected with the virus, and 4.07% of the infected population died. That is a large number considering the short period of time the events happened. But the disease was kept in check. As you can see here, the curve has flattened with very few new cases appearing. Remember, this is where it all started, and there was no known treatment at this point. Yet, China was able to flatten the curve. They achieved this by complete lockdown of the hotspot city of Wuhan and enforcing strict quarantine procedures. This enabled them to enforce a real social distance between an infected and non infected person and break the chain of virus spreading from one person to another. I have not shown the data here, but South Korea was the next country to be affected, and by undertaking strict monitoring and quarantine measures like China, they were able to keep the pandemic in check too. Next, let's look at Italy, which in terms of timeline was the next country to be hit very hard. As you can see here, relatively a considerable number of populations are infected and the death rate is very high. They suffered serious damage as lockdowns, quarantine, and social distancing practices were delayed in many parts of the country. Once the restrictions were in place, the country is now slowly flattening the curve with no big spikes in the number of new cases. The high death rate reflects two things. One, Italy is one of the oldest populations in the world, and COVID 19 has been merciless to the elderly. Number two, varying standards of health and healthcare across the country and the delay in implementing social distancing was a key factor too. Then comes Spain, with their impact much on the lines of Italy and with a higher death rate too. This was despite Spain being one of the countries with the best healthcare system in Europe. The delay in strict enforcement of restrictions and social distancing were the most important reasons for such high numbers. If you move on to Germany, you are seeing a comparatively smaller number of cases than the other European countries and a much smaller number of deaths. Reason, they have a high number of hospital beds and ICU beds than other European counterparts and were quick at implementing restrictions and testing. The social distancing made its impact by flattening the curve and in turn reduced the hospitalizations and reduced the deaths. USA now tops the world in both number of infections and COVID-19 related deaths. Although there are some early signs of flattening, it is still a long way to go as more tests need to be done and increased social distancing practices. When these are implemented effectively, it will greatly reduce the burden of our medical staff and the death rate can be brought down. The data we have seen so far is very clear in supporting the role of social distancing in slowing the virus spread and to break the chain of virus spread. That brings us to India, and the numbers you see there can surprise anyone. India is a densely populated country with the world's second largest population of 1.37 billion, and yet the number of cases is only 6725 as of 9th April 2020. You would want to look at that closely, and let us do that. There are so many hypotheses behind these low numbers, but I can assure you social distancing is not one, despite the government restrictions and rules. The first hypothesis is the effect of BCG vaccination against COVID 19, and this is strongly supported by a recent article too. When what you can see here is the low number of people infected by COVID 19 in countries with BCG revaccination practice and high numbers in countries which don't have one. There is clearly a path here worth pursuing, and there is some news about clinical trials being initiated in USA with BCG vaccine. There is some earlier evidence too pointing to the non-specific antiviral effects of BCG vaccine. That brings us to the next hypothesis. Does the Indian summer influence the virus? There are contradicting views on this, few supporting the theory that, like the influenza virus, COVID 19 could be seasonal and the summer can slow it down, and a few against this theory. Neither of these theories have any direct evidence and cannot be considered. Finally, are the testings being done throughout the country? That's a difficult question to answer, as many states in India have started their testing late. Some southern states of the country, like Kerala and Odisha, have been very prompt and widespread with their testing and implementation of safety guidelines, whereas some other states have been very slow in picking up. This disparity could affect the reported number of infected people, although there is hope that the damage may not be as devastating as other countries. Thank you for watching, and if you liked the presentation, please press like and share and send your questions too. Thank you. Stay home and stay safe.